So I was born in Thomasville, Georgia, but I grew up and spent my entire life living in Albany, Georgia. And then I have additional family. I'm on my dad's side of the family and my mom's side that also live in rural areas in South Georgia. Going to visit his family, seeing where he grew up, spending a lot of my time there, really exposed me to what life is like in rural Georgia. The life in rural Georgia is a lot simpler. You have the resources that you need, but you also lack some of the resources. So for example, healthcare. Sometimes you might have one doctor for the community, sometimes you might not have any doctor for the community, and you have to travel to other areas. So like my dad's side of the family, they often had to travel to Albany, which is 45 minutes away, to get healthcare. My grandmother, who lived in Vienna, became very sick, ended up in the hospital, had to be transported to Macon. And so I saw from that experience just how not having access to like ICU level care and just like resources and doctors, how that negatively impacts someone's health outcomes. So even from like a middle school age, I knew I wanted to go into medicine. I came into med school knowing that I wanted to do pediatric medicine. I never really considered much else. And I ended up applying and getting accepted to Mercer University School of Medicine. I went straight from undergrad into med school. And so I initially did not know about the Rural Pediatric Scholarship Program.
The motivation behind our Rural Health Initiative is really about how do you build pediatric capacity across the state. But for us, we knew that there were unique circumstances for kids in rural communities that we wanted to address. Over half of the rural communities across the state don't have a pediatrician. Many have never had a pediatrician. So when you start to think about sustainable change, it was about investing in the workforce of the future, really creating sustainable solutions.
My advisor at the time, Ms. Terry Walker, told me there was this secret thing happening on campus and that she wanted me to come. I showed up to the luncheon, and at that time they announced the Rural Pediatric Scholarship Program, and I was so excited for it. It sounded like something that was so perfect for me. And so I applied, and I was accepted as one of the first Rural Pediatric Scholars. The commitment of the scholarship for having your medical school tuition paid for is that you will go to rural Georgia for 4 years to practice rural pediatric medicine. So I'm a second-year resident with Morehouse School of Medicine. We do most of all of our rotations here with Children's Healthcare of Atlanta, rotating through Children's Hugh Spalding, Children's Scottish Rite, and the new Arthur M. Blank Hospital. And I honestly think it's been an invaluable experience. Like, we get to see the sickest of the sick kids. So a lot of the attendings have offered to stay in contact. Many of them know I plan to go to rural Georgia, and I've offered to be available. So I've experienced a lot of the challenges that I'll probably experience with my patients in rural Georgia.
Through this collaboration, we have an opportunity to make generational impact on these communities that we serve. So making a future for kids across the state that includes quality healthcare is key to what we want to do, and it's key to what our collaborators at Mercer would like to see happen as well.
I am most grateful to Children's, to Mercer, for honestly taking the chance on me, for seeing something in me before that made them think that I was the perfect choice for this scholarship. I feel hopeful about the future of healthcare in rural Georgia because I feel like in the last couple of years, there's been more awareness about the issue. I'm excited to start my attending job, excited to get involved, to be an influence to kids, hopefully encourage some other kids to go into medicine.